All right.
Welcome, everyone. This is the Annie Research Forum monthly call for August, and I will turn it over to Jessica.
Great. Thanks so much, Hannah. Hi, everyone. Thanks so much for joining us. My name's Jessica LeClaire. My pronouns are she, her, and I am the new and incoming co-chair for the Annie Research Forum, along with Dr. Claire Richards, who was sort of last minute unable to join us today because she's sick and has a sick family. So, but we look forward to launching this, and we just have a great lineup that we're planning for the year. So we do meet every month. I think it's the fourth Thursday of every month. So thanks for joining today, and we hope to see you back next month as well. I'm a postdoctoral trainee with the University of Wisconsin-Madison School of Nursing also. And we're really excited today to welcome Dr. Julie Postma as our first speaker this year. Dr. Postma is a professor in the Department of Nursing and Systems Science and the Associate Dean for Research at Washington State University College of Nursing. She has over 15 years of experience working alongside community partners in the promotion of environmental health and justice in Hispanic communities, and primarily in terms of focusing on the impact of housing on asthma. Dr. Postma is the 2023 to 2024 Climate and Health Scholar for the National Institute of Minority Health and Health Disparities with the National Institutes of Health. And she served on the 2023-2024 National Institute of Nursing Research Climate Change and Health Working Group. And because we have Dr. Jessica Kastner in the house, I also just want to give a shout out that Dr. Postma is faculty also with the Environmental Health Research Institute for Nurse and Clinician Scientists, where I had the pleasure of meeting Dr. Postma and other faculty just last month there. So Dr. Postma, I'm really looking forward to your presentation on building a program of research in environmental health and justice. For those in the audience today, we're hoping this could be a casual presentation and discussion. So please feel free at any point to raise your hand and ask questions or put questions in the chat, and we'll keep an eye on that too. So I'll pass it on over to you, Dr. Postma.
Great. Thank you so much for inviting me to be here. Let me make sure I pull this off just a second. All right, did we do it?
Yes, looks great.
Tech check. Okay, awesome. So yeah, happy to be here. Sorry Claire couldn't be here. She is a dear colleague and friend of mine, but as Jessica said, not feeling great, so better that she get well. So I was asked to speak, and yes, I would love to make this a casual conversation. I did create about 16, 17 slides because it was wonderful to kind of reflect on some of the activities and find some photographs and think back on a little bit of where I've been and where I'm at, and then maybe brainstorm with you where I'm going. So I will present these slides and then just hoping to have a conversation. I did not put slides together in terms of lessons learned, but I have a number of topics that I can throw out, or depending on your interests, you can ask about just sharing our knowledge together. Anything I can do to help you on your journey and specifically in your research career and trajectory in environmental health and justice, it would be an honor and a pleasure. So my introductory slide. Let me move you a second. So I'm from Michigan. I'm from Holland, Michigan, and I really wanted to go to the University of Michigan, to step outside of my smaller town, and that was a big step, and I was thrilled to have done it. And I look back at my 18-year-old self and I think, good job, way to go. So I earned my Bachelor's of Science in Nursing in 1998, and an important part of that journey was being a summer 3 intern at the Mayo Clinic in Rochester, Minnesota. So I had an ability to work with nurses there and to just sort of be in a research-oriented environment that was rich in inquiry, had a lot of interdisciplinary opportunities and respect, collegial respect. And it was a fantastic first clinical experience. From there, I went on to the University of Washington Medical Center. At both places, I worked in cardiothoracic nursing. At Mayo, it was an intermediate care area with a number of patients that had mesothelioma, which is a type of lung cancer that results from exposure to asbestos. And that really got me interested in environmental health and occupational health. In particular, the fact that people were exposed after short periods of time, after summer jobs, for example, and then developed this cancer 40 years later, we would detect it. And most of them did not make it, sadly, because of the time of detection. It's really too late to do a lot. But it planted a seed, it planted a seed in terms of inquiry, in terms of learning more about environmental and occupational health. I took my first graduate class in Winona, just as a 3-credit on the side class, and learned about screening, thinking that everyone should have a chest x-ray, that's smoked every year. So I learned a lot about screening and specificity and sensitivity and why that may or may not be a good idea. So inquiry, again, just sort of seeds were planted. Moved to Seattle because I'd always wanted to live west, and I started work at UW Medical Center in the ICU. Had an opportunity to work with transplant patients. That too was an incredible clinical environment. But that seed wanted to grow. I had an opportunity when I was there to take free classes at the University of Washington, up to 12 credits, I think. And I jumped on that opportunity. And I started taking some epidemiology classes and a public health class. And it really broadened my perspective, both in terms of the work that I was doing and how that work was situated in this larger healthcare system. So I started inquiring with people about how to maybe get a job as a research nurse. I talked to program advisors at the graduate schools to learn more about master's programs in nursing or a master's in public health. And I was invited to apply to the PhD program, which I really knew very little about, took a big leap there, was told that there was funding, which spoke to me, frankly, and was supported on training grants at the University of Washington. So those were T32 mechanisms. I won't get into the alphabet unless you want to talk about the alphabet. But I was supported in this incredible and research-intensive environment with nursing scientists, as well as science in public health, occupational health. I also took classes in anthropology, which is a really integral portion of my education, and had an anthropologist serve on my committee, which was absolutely fantastic. From there, I stayed on for 2 years as a postdoctoral fellow, and then started at Washington State University in 2009, and have been there ever since, with just climbing that career ladder with the tenure track role. So assistant professor to associate professor with tenure, then started as an assistant dean and now an associate dean for research. Just to give you a little idea of Washington State and WSU, the purple star here marks the Seattle-Tacoma metropolitan area, where the University of Washington is located and where I earned my PhD and then returned to do some work that I'll talk about in a minute. Much of my research has taken place in central Washington, so that's in this region. And that is where we grow apples, peaches, cherries, hops, and other crops that are irrigated by the Columbia River. That also takes a lot of people power in terms of planting and harvesting those crops, versus out here in far eastern Washington, we grow wheat, but that's a much more mechanized crop. So there's not as much human labor involved. And again, I'll talk about that in a minute with my research with agricultural workers. And then that red star represents WSU Spokane, which is where my home campus is. That borders Idaho, and it's about 4.5 hours in between Seattle and Spokane. And I've worked in all of these regions. So that's just kind of an interesting bit. We also have campuses for WSU because it's a land-grant college at various places throughout the state, as well as extension offices. I happen to work remotely now from Chico, California. Happy to talk about that if you want to. Otherwise, I will just move on. Much of my work still is based in Washington. So as I mentioned, as a nurse working at UW, I could take some courses for free. So I started out with epidemiology and ended up applying to the program. I am a bachelor's to PhD. I don't have a master's in nursing. I did not earn a master's in public health, although I have a little bit of a regret there. And I took occupational and environmental health courses alongside my research courses. And a core set, because I didn't come in with a master's or have that advanced education in any kind of like cognate area. I also took these occupational and environmental health nursing courses, and that was some core coursework alongside the PhD program. My dissertation was titled Environmental Justice Discourses in El Proyecto Bienestar, or the Well-Being Project. And for that, I basically evaluated an early community-based participatory research study that was funded by the National Institute of Environmental Health Sciences. So that was pretty novel at the time. This was really early in the days that NIH funded community-based participatory research. NIEHS was pretty advanced, I would say, ahead of the game. Liam O'Fallon in particular and his programs. And UW, University of Washington, had the main grant there, and then we had partners with the Yakima Valley Farm Workers Clinic, Heritage University, which is a minority surveying institution, and Radio Cadena, which is a Spanish language radio station, nonprofit in the Yakima Valley. And the goal there was to work across these partners, clinical partners, grassroots environmental justice partners, to prioritize occupational and environmental health issues in the farm worker population. So I was really interested in how power and privilege worked in that context, in that kind of the clash between this research enterprise and environmental justice at a grassroots level. So my dissertation focused on the language and practices used by these various partners to advance an environmental justice agenda, which of course meant different things to different people. And that was really foundational in helping me understand how power and privilege worked, from funding and budgets to representation on community advisory boards to hierarchies of power, and how people's words and actions were or were not taken up to actually advance environmental justice. I had a couple publications there. I listed some from this work, including Balancing Power Among Academic and Community Partners and Elucidating Empowerment in El Proyecto Bienestar, as it was defined by these various partners. At the same time, during my PhD education, I was in my theory class and had an opportunity to read this paper by Dr. Patricia Butterfield called Thinking Upstream: Nurturing a Conceptual Understanding of the Societal Context of Health Behavior. This is a really landmark paper in terms of environmental health nursing. And I was so excited about this paper and was talking to Dr. Carol Landis, my professor, about it. And she said, she's interviewing here in a couple weeks. And wow, what an absolute thrill. The universe aligned for me that day. And in fact, she did end up working at the University of Washington. And I had the privilege of being a research assistant for her on her NINR, National Institute of Nursing Research funded ERNIE intervention study. And ERNIE stood for Environmental Risk Reduction Through Nursing Intervention and Education. And so that study focused on the role that public health nurses can play in testing household contaminants, things like well water quality, radon, lead exposure in kids. We provided results for parents. The public health nurses, I should say, interpreted results with parents, provided education and referrals to promote a healthy home and a healthy environment. So it was really my goal to apply what I had learned in the ERNIE study about intervention research to rural and minoritized families in our farm worker communities. During a 2-year postdoctoral fellowship, I published 2 articles from my dissertation, which is the great thing about the time that you have during a postdoctoral fellowship to focus on research. And I positioned myself to apply for external funding. And so to that end, I conducted a systematic review that focused on community health worker delivered environmental interventions for children with asthma. I was looking at community health workers versus public health nurses, which was a little twist on the work that Patricia was doing, and really wanted to understand this in the context of FQHCs, federally qualified health centers, versus public health, because things were shifting in terms of what healthcare organizations were providing services for kind of safety net services. So I did that systematic review. I developed a conceptual model about these types of interventions and why they were working, and how community health workers might be contributing to how they were working with families, because outcomes were very good. And at the same time, I conducted a secondary data analysis of an asthma education program that the Yakima Valley Farm Workers Clinic was delivering through community health workers. So for example, we learned from that outcomes improved for families even with fewer visits. And that was really important because at that time, we did have more farm workers migrating for work. There was more movement between states, and families might not be in one location for 6 months to receive monthly interventions, for example. So sparked my interest in implementation research and kept me connected to the Farm Workers Clinic and some of those community partners. So upon starting a faculty position at Washington State University, incidentally, that is where Patricia became dean of the College of Nursing, I applied for a foundation grant as well as federal funding to continue this incredible work, and I did not receive either. So I'm going to say that again. I applied for a foundation grant, Robert Wood Johnson, and federal funding, and didn't get either. So there's a lot there, right? We can talk about rejection. We can talk about how that feels. But what I did was I picked myself back up and I took one of my aims from the federal grant and I applied to a WSU faculty seed grant program. I received that grant and it allowed me to fund my first community-based participatory research study. So it was important to me to not remain on the sidelines evaluating others, trying to do this work, and a critical stance is important, but I really wanted to kind of get in the arena and try it myself and work through the processes. So briefly, we asked promotoras, community health workers that worked with farm workers to share facilitators and barriers to children's environmental health in their community. And this experience was foundational in that it reinforced how important it is to listen to community perspectives and framing of the issues and potential solutions, as well as to disseminate study findings in a way that community members can harness for their advocacy efforts, which in general is not a peer-reviewed publication. So this publication, Strengthening Community Capacity for Environmental Health Promotion through Photo Voice, has a number of examples of how community health workers used this work to promote healthy housing, and that was very powerful. And that illustrates that point. At the same time, this community, specifically Grant County, was about to be recruited to join the National Children's Study, which was the largest study of children's health ever conducted in the US. And this is not a community that is overwhelmed with research opportunities. Yakima Valley does have a pretty strong connection with the University of Washington and has a lot of ongoing research. Grant County really hasn't. So it was a pretty research naive community and not necessarily one that would trust or feel altruistic about participating in federally funded research. So this was another opportunity to work with Dr. Butterfield, who was the PI on basically a subcontract with the University of Washington, such that we were in charge, our team was in charge of outreach and engagement for the National Children's Study in Grant County. This was a lot of money and a lot of work coming in fast. We created a field office in Grant County, which is about 2.5 hours away from Spokane. So that's important. I was the co-investigator on outreach and engagement. I walked in parades, I tabled at county fairs, I created what I hoped was a culturally appropriate and tailored plan so that when our field recruiters went door to door in a rural community, we hoped people, first of all, would answer that door to strangers and then answer really personal screening questions about if anyone in the household intended to become pregnant. That's who we were trying to enroll. So we had to ask these really personal questions, often, with Spanish speakers. And that was a challenge. We built a community advisory board, of course, and leveraged relationships that community members already had with, for example, radio personalities, people that they trusted. And then those folks would share, build awareness about the study. We worked with promotoras and others to raise awareness about the study in this community. And we were successful in recruiting a representative sample, which is the one publication I have from this very intense experience, is that. Lesson learned, this journal is not indexed in PubMed, so not a lot of people will ever read this publication. So talk to your reference librarians when you're planning on publishing. But then funding was cut by Congress. So we closed our doors on that field office and tried to do that carefully, with sensitivity, because you do not want to burn a bridge, obviously, with community partners, but it was pretty abrupt. So a lot of lessons learned there. So I had to pivot again. So I built on the Photo Voice work, which I was really proud of, both in terms of process and outcomes. And I started collaborating with Robin Evans Agnew, who you may or may not know. He is an extraordinary professor at UW-Tacoma, an extraordinary nurse, and he was also using Photo Voice. So I continued using Photo Voice as a tool for community mobilization. For this work, we got funding from PCORI engagement grants and the local hospital foundation. We leveraged the Puget Sound Asthma Coalition, which we were both involved in, and we recruited Spanish-speaking mothers of children with asthma to take photographs representing challenges and facilitators to asthma management in their community. And again, what was most powerful about this experience was how they used these photographs. And they used them in multiple ways, from hosting this gallery and this public event on World Asthma Day, which is pictured, to educating other parents at English language classes at the local community college to talk about regional asthma triggers, because these families recognize that coming from Mexico, for example, you might not be ready for the mold in the Northwest, and that might be problematic. They also created and piloted an environmental assessment tool for families running informal daycares. And they educated their pediatricians at MultiCare about things like smoke exposure in multifamily housing and the reality of trying to keep your kids away from smoke when you're not smoking in your house, but it's coming through the walls. So again, I'm most proud of our very intentional work involving these extraordinary women in broad dissemination of their findings, including co-authoring publications in journals like Progress and Community Health Partnerships. And that's a publication on its own. It's Robin's to publish, but he met women at McDonald's because they had basically free childcare with the playground, inexpensive coffee, Wi-Fi, and had a wonderful process that he used to have them write elements and then bring these papers together. Just phenomenal. At the same time, I was still seeking NIH and PCORI research funding to fund intervention research focused on asthma management. But for many years, I continued to be unsuccessful in these ventures. These are just a few of 50 plus unfunded grants. I think that's really important to include in a talk like this. It was very powerful for me at one of the Western Institute of Nursing research conferences. The distinguished lecture one year presented a bar chart of what she did have funded and all the grants she didn't have funded. So I think it's important to normalize that. And so I just wanted to share that these were just 40 out of 50 that were not funded. This was a great time for me to go on a sabbatical. So I did, and that's a great time to pivot. Took a little, I had to let go of a program of research, and I wanted to rebuild. I personally took some of that time and went on a trip to New Zealand. I would love to share a million pictures from that trip and then stay focused. But sabbatical is a very good word in the English language. Happy to talk more about applying for a sabbatical. But when I came back from that was in 2016 and 17, I pivoted. Our world was rapidly changing. Wildfires were causing poor air quality for days and weeks at a time. I was invited to join a collaborative team with an engineering colleague, so a new relationship, whose student was correlating wildfire smoke-related tweets with spikes in poor air quality. So this provided a novel way to listen to the community, to a huge cross-section of the community facing a new risk, a risk that impacts mental and physical health and is only going to get worse as the climate changes. So I applied for another NIH grant, and this time, NINR funded it. And so this was an R21. We designed an intervention to test a smartphone application that we created for young adults with asthma. And I think we received this in March of 2020. So we transitioned to having everything be done remotely, which was a challenge, but a pretty exciting one. We modified an existing smartphone application called SmokeSense that was created by the EPA. We added new elements specific to people with asthma, including using a portable spirometer pictured there on the right to assess their own airway narrowing and track symptoms in response or in relation to wildfire smoke. We also had a discussion board trying to encourage peer-to-peer support, sharing tips and strategies for asthma management during poor air quality. We found great acceptability and good in terms of feasibility with this work. We had incredible engagement with the portable spirometers, and participants offered multiple suggestions to improve the smartphone application, which they found acceptable, but not all elements were particularly engaging. Honestly, this study ended in 2022, 2023. I've had 3 federal grant applications rejected for continued work in this area, as well as some smaller grants. So I'm not sure what the next step here is going to be. But it seems like I've come full circle back to a focus on farm worker health in this last year or two, but now in the context of climate change. So some priorities such as heat have not changed. I mean, in 2009, in my dissertation, heat was a priority at that time among workers, but other things are new. Wildfire smoke poses a new risk. I've had the absolute pleasure these last few years of mentoring Molly Parker, who's in the middle in that photo on the left, who recently graduated with her PhD in nursing. Her program of research is focused on climate health and justice, and she recently published this paper, Agricultural Worker Perspectives on Climate Hazards and Risk Reduction Strategies. And her second mixed methods paper is about to be submitted to the Journal of Agromedicine. She wrote a letter of inquiry and they invited her to submit, which is really, really exciting. So this team is giving me great joy. This is Sheila Hurst. She's a clinical track professor at WSU. Molly's in the middle. And then Juliana Romo is an undergrad nursing student. They were all at this conference collecting these surveys, and they're a phenomenal research team. Likewise, my collaboration with that engineering colleague, Dr. Von Walden, benefited another PhD student in nursing, Tara Marco, who's on the left. Dr. Tara Marco now. Her F31, more the alphabet soup, was funded by NINR to explore the association between maternal exposure to wildfire smoke and neonatal outcomes. And then just one other project I wanted to highlight, Dr. Molly Parker led, and that was our planetary health report card, which we did for the first time last year. And both Tara and Molly, as well as Dr. Hurst on the last slide, were Jonas Scholars in Environmental Health. And that supported 2 years of their PhD program and involved a leadership component. So this planetary health report card was Molly's leadership component. Finally, I think I've got 2 more slides. I've had the pleasure of teaching spirometry and photo voice to nurses from across the country, including finally meeting the famous Jessica LeClaire for the first time. And this was via participation in Dr. Jessica Kastner's Environmental Health Research Institute for Nurse and Clinician Scientists. This is an NIEHS-funded R25 grant, which funds research education activities. So we are going to host WCU Spokane in 2025, and I am looking forward to seeing some of these amazing people again. And then finally, Claire wanted me to touch on the fact that over the past year, I've served as the NIMHD Climate and Health Scholar. So this program is only in its 2nd year. And in that role, I delivered a few national webinars on farm worker health and climate change. And in July, we had this conference that I co-hosted with a program advisor or ambassador, I guess they call her, Ariel Gilman from NIMHD. And that was called Climate Change, Health, and Justice, a workshop on community-engaged research to promote health equity. And I was really proud to have stepped up and stepped out this year, often beyond my comfort zone, to share my experiences and lessons learned working with minoritized, rural, working populations, pushing for more intervention and implementation research that really reflects what workers face on the ground, not just in places like Washington, but more importantly, in places like Idaho and Florida, who often lack protective policies. So I'm going to stop there with this beautiful photograph of the rainbow over Niagara Falls, because to me it represents the joy in this work amidst the often turbulent waters of the research enterprise. And with that, I am going to stop my screen share and get back to you all. And I know I just sort of talked for however long I just talked for, but I have, again, a number of things I could talk about, but wanted to see what questions you all had.
Thank you so much for that wonderful presentation. And I just feel so inspired by all of your work and your trajectory, and grateful for the path that you've really paved for the future of nursing research in this area, and the support that you're giving to emerging scholars too. So I just want to voice that. And yeah, we have the rest of the time, about another 22 minutes or so, for questions that anyone has. I have a ton while people are sort of collecting and thinking about the conversation. I just want to lift up Anne-Marie Walton's comment in the chat. And Anne-Marie, I don't know if you want to share more about this, but I was also feeling so grateful, Dr. Postma, that you are normalizing and validating how hard it can be to obtain funding for this work. And so, Anne-Marie, if you want to expand on that a bit.
That's it. I just think you're right that we don't hear about we don't put on our CVs, we don't hear about the unfunded grants and all the work that goes into this. And so hearing that you took some time away and some time to rethink and refocus and pivot is really helpful, but also that you broke through, right? And it happened eventually, I think is some of what we need to hear.
And there are always voices, well, I shouldn't speak for everyone. There are voices in my head, as well as people in my circles that that just don't recognize some of the good work that has been done, in contrast to, I have not had an R01, you know, the pinnacle of NIH funding. And in particular, this last year, some voices were a little bit stronger in that regard. So I wanted to make sure to talk about that. And yes, to normalize that, to say it doesn't necessarily feel good to keep trying and not make it, but also to say, just put one foot in front of the other and keep doing the good work. And celebrate the Jessica Kastners and the Jessica LeClairs and the Claire Richards and this community, because that's more important than those stupid voices.
Thanks. And that is a goal that we hope to continue building with this research forum with Annie, is to really support each other, be there for each other during the hard times, but also celebrating all the successes that we have along the way too. So other questions or comments or reactions? Well, folks are thinking, I'm going to jump in. So one thing that I would like to hear more about is your work that you've been doing with the National Institute for Nursing Research, particularly on the climate and health work group that you are a part of and providing recommendations moving forward. My sense as I was listening to your program of research is that you might have been almost a little ahead of where the funders were at, but they're maybe catching up now. There is a lot of interest from what I can see at NIH around community engaged work, as you alluded to in your presentation, to the point where they're even looking at having community-based organizations being the PI and the primary funders through the COMPASS program too. I don't know if you are part of that or know more about that, but maybe speak to sort of future directions and where you see some opportunities.
Yeah, that's a great question. Happy to reflect and think on that. So that was a real pleasure to serve on that advisory group. I have no doubt my involvement with Jessica Kastner's R25 was a part of that. And maybe the R21 that funded the smartphone app as well. I got to sit with nursing leaders from across the nation. Adelita Cantu was on that group. Daniel Smith was on that group. Teddy Potter was a part of that group. What was most important to me was bringing the voices of some of our junior faculty that are absolutely amazing, Claire Richards being one of them, Melissa Vera, Indigenous scholar, being another, and represent their priorities for research as well as mine, because I know that my involvement over time in these ways that I have had opportunities to be involved, got me to be at that table and to be a voice at that table. But it was really important for me to broaden that voice and represent some other voices that are frankly a bit more cutting edge, Claire, and also using different methodologies to appreciate different ways of knowing. And I'm thinking of the Indigenous communities that Melissa works with and is a part of. We definitely pushed for a number of social, recognition of social determinants of health, a focus on social determinants of health, more community level and system level interventions or implementation science. I think that's been a pretty common thread whenever we talk about climate change and health equity. I think there's an important conversation that is happening with NINR, not just NINR and NIH and possible restructuring there, but in terms of NINR's changed strategic plan. And, there's growing pains there. And I think for me, it's important to recognize that we need to build bridges between not just the old strategic plan and the new strategic plan, but recognize that our nursing mentors were operating under the old strategic plan, and we can't just throw that out. And I appreciate the new framing for sure, but I also recognize we need to lean on the shoulders of giants, of our nursing mentors that have been focused on symptom management, for example, and end of life care, versus some of what we're focused on now. I do think wonderful paper by Jessica and colleagues, with symptom management, recognizing environmental health in symptom management. I think those are exactly the kind of bridges that we need to build there so that we can continue elevating nursing science and not throw the baby out with bathwater. I hope that answered your question.
Yeah. Thank you. Dr. Kastner, I saw that you turned on your video. Would you like to comment or have questions?
while she's writing, I'll say too that we need to recognize that some of the community-based organizations well, there's capacity. There is a tremendous amount of capacity that one needs to have to follow NIH guidelines, to, to understand the reporting requirements, to be stewards of those funds. And it's tricky even at an institution. I'm in an R1 university, and it can be tricky to figure out how to submit a report to the NIH. So we have to be thoughtful about diverting attention from the work that community-based organizations are doing on the ground with the people and that part of it. And it's a tricky balance. I did not get Jessica's comment if
It looks like she's saying good job.
okay.
It's like, great work, super inspiring.
I can't say enough about mentorship. I was so lucky. Like I said, the stars just aligned, I feel like, with meeting Patricia Butterfield and being able to work with her versus reading a paper, which I was excited enough about reading a paper about environmental health and nursing. But to then be able to work alongside somebody, who taught me things like what indirects and F&A was, as well as what it looked like to have a subcontract with a health department, but also shared, her vision, her theoretical conceptualizations, her, her knowledge that public health nurses know this stuff and can do this stuff. We need to carve it out, and we need to call it out. And it was interesting, I touched on this, but, there was a transition with the Affordable Care Act in the years leading up to it around those safety net programs. And I didn't see health departments necessarily, certainly the environmental health department in the public health department certainly has a charge, but I was seeing a lot of transition in rural counties from health departments offering clinical services to federally qualified health centers offering those services. So as a younger person working with Patricia, that was a change in kind of our vision. And it was just interesting to, try to figure that out, because mentorship, there's never just one person, right? There's ideally, don't put all your eggs in one basket. You want to have a broad group of mentors, and she respected that difference in kind of what we saw as the future there. But at the same time, that meant, broadening my mentorship pool, if you will, in order to get that expertise and those connections.
Yeah, that's really interesting. All right, so I'll read Dr. Kastner's comment here. She says, I love the comment about the need to be agile and pivot with the new NINR strategic plan while honoring those who educated us under the previous plan. After your time as an NIH Climate Health Scholar, what insights do you have about how that might continue to evolve over the next 10 to 20 years?
Big question with no time to think about it. I'll take the first part. In thinking about the NINR strategic plan and the conversations I've had around it and some of the tensions I recognized from it, I'll say that I feel like there needs to be, and I am not on the inside of this at all, so that's important to say. I'm really on the outside, and I know this is being recorded, so I don't know. I'm just gonna say it. I feel like there's camps, like there used to be with qualitative versus quantitative research in nursing, and I feel like we've gotten through that. But I feel like there's an old guard and a new guard, and those leaders kind of need to get together and work through that tension, and I say that because on a very concrete level, we need those seasoned, wise, older mentors to engage in this work. They are the people that have had the NIH funding, and we need to learn from them. But if they're upset about their programs of research no longer perhaps being recognized at the higher level, or this pivot. I mean, there's power dynamics there too, and there's money, and there's longstanding programs, and I'm sure that's changing. I work pretty, not myopically, but I'm very Washington focused, so I'm not at these National Academy meetings and whatnot, but that's what I would say from my position is our world needs that new strategic plan. So let's get it together and figure out professionally how we can make that happen, or maybe some of those older programs of research can be shifted into these new lenses. So that's what I said there. 10 to 20 years. Oh, Jessica, you're so visionary. I guess I addressed that a little bit in terms of getting together and recognizing, I'm thinking Claire Richards. I'll say this, Claire Richards, moved from a program of research focused on palliative care to thinking about climate change, power outages, how do people at home with durable medical equipment deal with these new risks? Like, that's a beautiful bridge, right? So we can think about end-of-life care, palliative care, some of the elements in that older strategic plan, but in this new kind of worldview we have around these priorities like climate change, health equity, so I think we all need to be flexible. And I think it's harder as I get older to be flexible. So I can appreciate that that can be harder for some than others. But I really celebrate our younger scientists who, like Claire, came in and said, this is my focus, and help me pivot. And I'm like, all right, I will do what I can. Although I'm not that senior funded researcher that can open all the doors, but I certainly am committed to doing what I can, because that's what needs to happen. Especially now that I've moved to California and see what it's like to live in a region with wildfires.
Yeah, thanks so much for sharing those insights. And again, the importance of supporting the next generation of nurse researchers in this area and providing that guidance moving forward. I know we have just a few minutes, but I've been reflecting on, again, our experience with the Environmental Health Research Institute and learning about a translational framework. I know you've utilized this in sort of talking about your research in the past. And I wonder, I was imagining the impacts that are so profound with your research. It goes from directly supporting community-based organizations and groups in their own priorities and their own advocacy efforts. It's potentially understanding and influencing community health worker practice. You also have experience with public health, nursing, intervention design, implementation. When you look at practice or policy or advocacy, what do you see as sort of some overarching impacts that you're hoping for from your research?
Great, thanks. That's a great question, Jessica. Well framed. Right now with the Farm Worker Health, we're really focused on policy. Our work has fueled education and advocacy in terms of a new occupational health policy around wildfire smoke exposure in Washington state. But I can't speak enough for the need for federal legislation around heat, for example. Momentum is building, especially after what happened in Florida as compared to Arizona, with local jurisdictions, trying to enact. Well, in Arizona, they enacted in Phoenix at the city level protections for outdoor workers, and then in Florida, the governor decided to ban all protections for workers at the city level in response to that. So, it's great the work that we're doing in Washington state. It's great that California has progressive occupational health laws, Oregon as well. But we're right next to, my campus is right next to Idaho, and they do not have protective occupational health policies. So that policy work is critical, but policies only go so far as enforcement of policies. And so I don't want to put all my eggs in that basket either. There's still work on the ground that needs to be done. Just because there's a policy doesn't mean it's being enforced. We have, NIOSH, or OSHA, I should say, has a sad budget for enforcement. So it's not to say that all things should be system level or policy level, because at the same time, workers coming in from other countries, that are not working for, in a company that has a culture of safety, they need a face mask. They need a face mask for when the wildfire smoke hits, and they need an evacuation plan. So, there are still individual and or group level kind of interventions that need to happen, helping people understand how to assess wildfire smoke hazards and what they can do in a pretty limited, constrained environment to protect themselves.
Great, thank you. That's very interesting, and it seems like a lot of work. And also, I appreciate that not putting all your eggs in one basket comment too, because there's multiple impacts and multiple ways to influence. And
I do think the federally qualified health centers are a key player in rural environments, and we should be integrating them as much as possible with our nursing research.
wonderful partnerships that can be developed moving forward. Yeah. Great, thank you. Well, before we close out, I just want to pause. If there's any burning questions or comments. Checking out the chat too. Another comment from Jessica Kastner. I'll read it out loud for those that are going to watch this later, maybe not. I can't see the chat right now. She says, Julie, this Annie research community is so fortunate to have your engagement and expertise. Likewise, each of us who work with you are fortunate to benefit from your outstanding collaboration. Appreciate you, and thank you so much for this talk. And I agree with those sentiments, and just getting lots of agreements here too. So yeah, thank you so much for taking the time to share your research journey and plans for the future and insights into how we can all integrate this into our own programs of research and support each other along the way. And just a quick applause to thank
I'm
you.
gonna applaud you. This is a great group. So such a pleasure to be here. And I'm Jay Postma at wsu.edu. Ask me anything. I'm a pretty open book. We can always text or talk and not do official institutional email. So, yep.
Yeah, that's welcome. And one of our own students, honor students from University of Wisconsin-Madison, says thank you so much for welcoming her, and she's learning so much as an undergraduate student, just entering the research world. So yeah, and on that note, I just want to welcome everyone to join us next month. We are still getting our speaker schedule aligned, so if you have interest in presenting your own research or even workshopping a part of your research that you want to discuss or have questions on.
I love that idea.
Yeah. Or if you would also, we welcome other stories of maybe pivots to integrate new integration of environmental justice and planetary health research, or from the ground up building it. We also want to capture your own stories. So just want to welcome everyone to the space, and thanks again. Hannah, should I turn it back to you?